Chapter 28. Oncology. A. Neoplasms. A neoplasms is abnormal new growth or tissue. Malignant neoplasms, cancers, are likely to spread and cause serious illness of death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth, you have a small tumor in the bowel. A lump or swelling is a collection or tissue of fluid which is visible or palpable. Can be palpated or felt with the fingers. A lump may be due to neoplasm, but there are other causes such as inflammation or fluid accumulation. Patients say, "I have a lump in my left breast." Doctors say there was a firm, palpable mass in the liver. A malignant tumor are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant parts of the body. Metastasis metastasis. Neoplasms, which are the result of metastasis, are called secondaries as opposed to the original tumor, which is the primary. We have the results of the scan black, new, and I am afraid they shown that you have a small growth in the prostate. Fortunately, it appears to be at an early stage, and there is no sign of spread of so if we remove it, there is every chance of a complete cure. Note: to invade verb is enter to spread throughout a part of the body, and this process is invasion. None if a tumor is described as invasive, it has the ability to spread. B. Symptoms and signs of malignancy. The symptoms of malignant diseases may be related to the site and location of the tumor. For example, a spay occupying lesion in the brain causes a raised intracranial pressure, and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may block the lumen and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. 33-year-old man present to his GP complaining of a painless lump on the right side of his neck, which had been present to about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilos in weight. He was also complaining of night sweats. He had no significant past medical history. C. Treatment. Treatment and tumors. A tumor can sometimes be completely removed or exist by surgery. If this is not possible, for example, if it has already alright metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only instant to relieve symptoms.